You can't replace part of the brain. Like, you
treat them the same.
A source of truth for the medtech industry.
Coexists with the province.
Robot understands things automatically.
Number one show in the medtech industry.
So Stryker got ahead of that and changed in the 90s, built $1 billion company that held up high, a lot of things.
State of MedTech with your host, Omar M. Khatib.
Hey everybody, welcome back to the show. Another investment/venture capital episode. I'm joined today by my good friend Tamir Meiri, who sits in a really important position in the medtech ecosystem. He's the director of venture investments at Johnson & Johnson. So we got a lot to talk about. Tamir, thank you so much for joining the show. How are you doing today?
I'm good, Omar. Thanks for having me. No, I'm good. I'm right after a weekend with the family, taking advantage of the Passover break the kids had in school. So I want to call it refreshed, so I'm trying to be optimistic.
Good. I'm glad I was able to get you post-Passover, so welcome back and happy Passover. And maybe before we jump into the topics today, I'm sure a lot of the listeners are curious about your background and more specifically, like, how does one become the director of venture investments at J&J? So maybe give us a little bit of background on yourself and how you got into this amazing industry, and we'll go from there.
Yeah, sure. So I would say maybe for people who are looking to get into venture that my journey into venture investing has not been really customary or traditional in that sense. Especially on the medtech side, most of the folks who go into that space have come through either an operational role, having been a VP or something of that sort at a startup or at a big corporate, or had a very good finance or investment banking background. I, on the other hand, would mainly call this a strike of luck and good timing. I was a paramedic in the Israeli military, and the normal kind of course of progression there is you go to med school. I had tried to go into med school and did my SATs 5 times in Israel, and unfortunately did not get accepted. Did do a very small stint in Budapest trying to get into med school there. Funnily enough, I had met my wife about a month before supposedly moving 6 years into Budapest for med school. That did not last very long, as you can imagine. And then moved back to Israel and started doing biomedical engineering and physical chemistry at Tel Aviv University. As I was graduating, I thought it's a decent hub for medtech. Why don't I just interview for a bunch of R&D jobs in one or other medtech companies? And I have probably gotten through 3 to 4 kind of offers potentially, but maybe a day or two before, or the weekend before supposedly signing a contract, and these were the days where we weren't signing anything digitally. It was all coming into the office and signing it face to face. There was an opening in one of the alumni groups on Facebook for an analyst job at JGDC, and I thought to myself, I don't have a lot of finance backgrounds. I do have a lot of business backgrounds. At the time, I worked at one of the largest law firms in Israel that represented a big chunk of the medtech industry as a personal assistant to one of the managing partners, but by no means a lawyer. And said, you know what, I should apply. It sounds interesting. I may not have the relevant background, but it was typical male philosophy of, I maybe fit 50 or 60% of the requirements. Why don't I apply anyway? And lo and behold, got the job a few days later. I think there was very good chemistry between my manager back then, Zev Zahavi, who had retired since, and effectively started within JJDC. It's the first job in my career. So this goes back almost 11 years ago. And as an analyst, I was doing call it dirty work when we do the investment. So anywhere from the diligence and writing the investment memos and all the internal presentations, supporting Zev and Gene Bolger, who was our ex-colleague based out of London, covering all sections for J&J. And over time, started sitting on boards as an observer and supporting various types of investments, whether it was pharmaceuticals or medtech or consumer, digital, surgical, robotics, you name it. And over time, I think there was a necessity to bring in another investor to the team because of just amount of deal flow and pipeline and portfolio. And that's how I got into the investor role over time and transitioned to the Bay Area about 3 years ago to manage our investments on the medtech side here on the West Coast. So it's, again, by no means a traditional trajectory. If you look at most of the partners, be it venture or managing partners in the medtech VC world. But I think it goes to show that if you're interested in something and you're putting all of your kind of grunt into it, you may actually get something done. That's my journey, at least.
No, that's fascinating. And I asked that just because before we had met, I can see your essentially career projection on LinkedIn. So I always thought it would be interesting to hear sort of the origin story. Now, diving into things, I want to start out with, we didn't get a chance to catch up that much at one of my favorite conferences of our industry is LSI. You were on a panel, a really interesting one. And I got to give a shout out to Scott Pantel and Henry Peckham team for putting together these just amazing panels. And so the one that you are on is a very funny title is Why the Heck Can't I Raise Capital? And we have a lot of founders who are listening to the show. We just had actually John Norris, who's the managing partner of HSBC. He put out a great report with his team. And that report showed that for med device VC investment for all deals for 2023, we're down 19% compared to 2022. And so I'm wondering if you can give us, like, at a high level from the seat that you're sitting in, why is it so hard to raise capital these days for medtech companies?
Yeah. So I think it's a combination of various aspects of things that are colliding at the same time. And obviously one of them is the interest rates, and that somewhat applies to the rest of the market, not just in medtech, where VCs are, in general, both CVCs and VCs are not deploying cash as they should or as they are mandated to, partially for good reasons, partially for not. But I think that's one reason. The second reason, in the days of COVID, so late 20, early 21 to the midst or maybe end of 21, and maybe even at the beginning of 22, there was a valuation bubble that was percolating as digital health started exploding in those days. And some of that, I don't want to say infected because maybe not the right word, but moved over to some of medtech and robotics and other very hyped areas of healthcare, and valuations even exploded there. So I can, not to name names, but there was a company that we saw early in 22 as I just relocated here, as things started opening up after COVID, where it was mainly a software-based solution and there was no revenue whatsoever. It was all promises and looks great, but they had an expectation of a $300 million pre-money, right? With no revenues to show for. And the product may have looked great, but it wasn't sold yet. It wasn't integrated yet. It wasn't generating any revenues. And lo and behold, almost 2 years later, they've not raised, not at that valuation for sure, and nothing that was disclosed. But I think the valuation bubble that we had the years before is somewhat of a reason of investors and investments not really following through this year as well. The other thing is, I think there's been a lot of focus around certain areas of med tech, robotics being one, digital being second, where there was a explosion of companies. And 1 to 2 years later, some of them have shut down, some of them merged with others, some of them have just disappeared completely from the map, just trying to pivot and rebuild something from scratch. And I think some of those failures or shutdowns are a bit of a cause for the hesitancy of some of the investors on the market. So you're going to see those where you have the tier 1, tier 2 investors, serial entrepreneurs who have done this 2, 3, 4, 5 times. They are probably likely to continue raising, maybe not at the expected valuation, but those that are more at the seed, Series A, first-time entrepreneurs are finding it more difficult to raise in general, I'd say, let alone in increased valuations from the previous round. We've heard the same kind of saying of flat is the new up, right? And down is the new flat. So it is a combination of all of those circumstances that is causing us to be where we are today. That being said, what we are seeing is, first of all, corporate investors like ourselves, but others are pretty much alike, are now more open to invest earlier than they would. So corporate investors like JGDC, normally in the medtech side, would look at things that are post First in Man or even later. We invest much earlier in some companies. We would do sometimes company creation. I can say the same for some of our competitors. We are seeing family offices that used to be only active in pre-seed and seed, now sometimes even leading a Series A or even a Series B. So it's an interesting dynamic we're starting to see these days in the market. But I would say there's this feeling where post JPM, post LSI, those big gatherings, and people attend, that there's going to be a complete recovery within a month or two. And I don't want to depress people, but it's not entirely pink as it looks like, in the sense that people are talking about potentially investing, but they're not all actually investing. So you are going to see PRs about new rounds closing, but not as many as you'd expect. And John's report, I think, speaks to that very factually.
Yeah, and I'm happy you mentioned that. And I think that it's one of those things that I think the more aware entrepreneurs are of the current climates. And again, we are in an election year. The price of money is really expensive. The Federal Reserve promised three rate cuts. We have not seen one yet. I was hoping to see one by this summer, but doesn't look like there's any sign of anything coming. And I think that for most entrepreneurs, would you say that having clarity around the given situation in the market allows you to be a little bit more creative about where you source capital and how you use it internally?
Yeah, I'd say yes as a general rule of thumb. What you can expect these days is depends again on the stage of the company, but any investment that we would lead or participate in, unless it's immediately after closing that you're going to get to that meaningful inflection point that either brings an M&A or the next raise, plan for at a minimum 18 months, but ideally 24 months and up, right? And that also entails the selection of the right investors, selection of the right people on the board, and everything around that. If I'm looking at one of the companies we are potentially leading in right now around, the founders who are first-time entrepreneurs are very carefully thinking about it in the sense that they are raising for a 24 months period plus a buffer. So there is going to be like a 2 to 3 months buffer there. And even though the funding gets them to, let's call it middle of 26, and we're recording this at the end of April 24, so it's 2 years plus, they are planning to start the fundraise for the next round at the end of 25. So 6 months, if not 9 months before end of cash, just recognizing how serious these things are. So if I'm telling an entrepreneur what he should plan for, so first of all, plan for longer, right? But that's almost a rule of thumb. But also select the players and investors who are not just going to be there just for the one round. Pick the ones that work from Series A to C, or those that could do an A, B, and then an extension. Those that have reserves, those that are somewhat tied into a bigger fund of a growth fund. And again, recognizing it may not be relevant for everybody, but I think the rules apply, saying it's not just a one-off, right? You need to find investors that are going to be with you at least for the next round, if not the next two.
I think that's really good advice, because at least from what we've seen here at the State of MedTech, like last year, it seemed that a lot of the rounds that were being led were not a whole lot of new money, a lot of add-on rounds and existing investors. When it comes to like company creation and let's say partnering with like larger strategics like J&J. So J&J last year was one of the corporates that led the amount of investments that they made in the medtech world. I don't know how else to put this, but what does J&J look for, or at least where you sit? What kind of like markets do you look at? Do you find interest in? Because a lot has changed in the last couple of years, and especially the bubble of 2021 changed a lot between now and then.
Yeah. So I'll cover mainly on the medtech side because Farm is left to smarter and more capable people than I am. But on the medtech side, every investment that we would do has to tie into where we're active in today. So it has to be strategic. There are the obvious areas and some of the acquisitions we've made in the last few years that well correspond with that. So the Abiomed acquisition of 2022, which was a wonderful acquisition. We brought in a great team, a great product, great people, technology capabilities into J&J. But putting Abiomed aside for a minute, there are four major franchises where J&J is active in today, which is our Ethicon, which is a general surgery business, including our robotics business with Auris and Otava. We have our orthopedics business, and that entails both implants, navigation, and robotics as well. We have our vision business, which is mainly in contact lenses and surgical vision, so a lot of things around cataract surgery, both the tools and the implants, as well as our cardiovascular specialty solutions, which is Biosense, Cerenovus, and Mentor. And there's been conversations about Shockwave, which are public, and there are other areas of discussions as well in the market. But I think all of the investment activity will have to tie into all of these businesses. Almost all of the investments that we do are publicly known. We've invested in quite a lot of companies recently on the medtech side. All of them correspond with those franchises. I think as a general denominator for all the investments that we would do, anything that we would invest has to first tie into the strategy, but also tie into a specific milestone or a proof point whereby the business would say, this is something I would like to own down the road, right? Whether it's by virtue of acquiring the company or acquiring the asset or licensing it or distributing it or whatever means there is to bring it into J. And that corresponds usually with our participation, depending on sort of the level and strategic rights and anything like that we would do. But that is a common theme across all the investments that we would do. So, for example, if you look at a pre-first-in-man company that we invested in in 22, it was clear what we wanted to see to believe in order to bring it in. The year after, we invested in a very late stage Series F company that is already commercial, but doesn't have the approval for that product that we would be looking for. And what we would want to see ideally is FDA approval, right? So, it really varies from company to company and technology to technology and which stage. But ideally, the leadership within the organization at J&J has to say, this is something I want to own and I want to see X to believe it.
Got it. That makes sense. And I'm wondering, just like from where you sit, and if you have any examples, please share with them, because the one thing we want to do on the show is educate like existing founders and entrepreneurs as to how they should think about building and structuring their companies, so that, because essentially when you have a startup company, you have two products. You have a product for the market, but also an investment product for investors, right?
Yeah.
For a company that's raising, let's say, a Series B or C, and if we can make a sort of a case example of this, let's say it's a company that's gotten through the regulatory pathway, they're about to go commercial. What are some things that you like to see from those types of companies? Some, I don't want to call it boxes you like to check, but what does an ideal company look like where you say that's a company that's on the right trajectory?
Yeah. So if I'm going to put a J&J hat and take it off for a minute, right? So we spoke earlier about what J&J wants to see, right? So normally we may be amenable to some, I don't want to call it naivete, but some more of an open mind around a business model or anything, as long as we understand that we're not expecting the company to commercialize it before we acquire it, right? And that's the exit pathway for a lot of companies in medtech, right? They are usually a single asset company. They don't really plan on commercializing. They just want to be bought out and be part of a portfolio of products by a big multinational corporate, right? That's one front, which I think is fine. Again, I'd still like to have some idea of independence at the company, in the sense that they would build something out that seems realistic, and they've talked to the doctors and the stakeholders at the hospitals, the payers, the insurers, whoever that is. Having said all of that, though, there is the other aspect of things where there are companies that the clinical risk may not have been as big as others. The technical risk has already been passed. And what really is still outstanding is the commercial execution risk. And usually this happens when these are companies like a corporate, like a J&J, but any other corporate kind of thinks the same, I would say, is we would potentially buy or bring this company in where they are selling to a new call point that we are not selling to, right? So a big corporate like J&J thinks very much, who is the physician, who is the kind of stakeholder we're selling this device procedure to. So let's call a spine surgeon. We're selling to the spine surgeon our tools, our implants. If you now go to a urologist, which we are not generally selling to today, you may have a wonderful product and it may be exceeding expectations and performing better than anything out there in the market, or even performing a completely new procedure. But if it's not selling to a call point that we are selling in today, it means for us that we need to completely build a new sales force, right? Because that's people who sell to that physician at the end of the day. When we buy a company like that already has some sort of a commercial sales force, that is also what we're buying. We're not just buying the product. We're also buying the people who end up selling and know the physicians, know the challenges in the market, know how to get into the market, where it's superior, where it's inferior, etc. So I think it varies from the type of company you want to buy, the stage of the company you want to bring in, and that also dictates what you have to build for the investors, right? So if your investors know that the plan is you don't go IPO / commercialize and try to raise now 50 to 70 million just to build a sales force, it's clear who you have to convince to get to the exit, which is the corporate you're trying to sell to, whether it's one or two. If you're trying to build a business, you need to bring in, and especially on the commercial side, people who have done this before. Maybe not in that specific domain, but have done this before in medtech, because doing it on your own based on assumptions and not having walked the pathway of a salesperson is a completely different story. So I think it really varies on what the exit pathway is, and then therefore dictates how you build the company in terms of the people, the strategy, the fundraise, and who are also the investors you're going to reach out to, because not all the investors are comfortable with a commercial execution risk, right? Some are and are willing to fund it, and some are not. So a lot of it varies between which type of company you're trying to build.
I think it's a really good point. I'm glad you brought that up just because, again, I think it's case by case example, but I feel that, and you let me know if I'm wrong in saying this. I think there was a time, maybe, 5, maybe even 10 years ago plus, where you can have a company with a product and a good amount of patents behind it. And you don't have to commercialize, you can get acquired. I think times have changed now where that same company, you have to build a viable company that can stand alone. And more importantly, when getting acquired, you're acquiring a commercial process. You have a market that's been educated and nurtured, and it becomes a much easier acquisition target versus like acquiring a company. It's okay, cool product and patents. Now we got to build a whole infrastructure around this just to make this work versus having that all set up. I always felt that the right way to build a startup is to believe we're going to go it alone and we're going to build a company like that versus just trying to build a company for acquisition. Would you agree with that?
It really depends on the domain, right? Because when you think of, let's take cardio, for example. So like a TAVR or any mitral related device, right? I don't think that most of the companies, even those that are advanced, are considering seriously to be an independent company, right? There are, 3, 4 gorillas in the market. If you're not there, you're probably not going to scale as much as you think, right? There are other areas similar to cardio. There are different areas like orthopedics, for example, where there are big players in spine, there are big players in trauma, and very rarely will you have a consolidated big player that has all 4 or 5 different aspects of orthopedics, like J&J, for example, or Stryker. So it really depends on the domain. Now, in some areas that are still, for example, up and coming and still growing, and you'll see maybe not the big, you are seeing the big players, but you're also seeing a lot of mid-sized players, is neurovascular, for example, which is a big growing area. You're seeing a lot of new solutions, both on the hemorrhagic, both on the ischemic. Again, most of the exit strategy is to be sold, but you are seeing players like Penumbra. You are seeing players like Inari. You are seeing players like Imperative Care, which are not small companies, but they're not J&J big, right? And they're trying to become big competitors in that space and trying to increase their portfolio and go into areas that they were not active in today. So it really depends on the domain, and that somewhat dictates how you build your company, whether it's as a standalone and trying to compete with the big leagues, or is your intent to be bought and then compete with the other big leagues. Historically, what the big multinational companies like the J&Js and the Strykers and Bostons do, some of us do very good R&D internally, but what we really do good is scale, right? We could take a product and immediately launch it in like 100 countries. And I think that's what most of the companies in the startup space are looking to do eventually, is expand the reach and grow and get to as many patients as possible.
No, that makes a lot of sense. What about like from where you sit, are there certain areas that you personally enjoy investing in and doing your due diligence on? I know you love all your babies, but I'm sure you have some favorites.
Yeah, nobody has a favorite child, right? Obviously, I think everything is interesting. I always geek out about like really cool engineering ideas, things that kind of take an existing domain or known aspect of technology and then translate it into medicine or like a completely different indication. I find these things to be very elegant. And again, it doesn't have to be like quantum physics or something that's super complicated. It's entirely taking off the shelf items or capabilities or know-how and translate it into something that really has a huge unmet need. So the 2 stories I love to tell are both in orthopedics. And again, by no means am I suggesting there is a favorite domain, but as a chronic orthopedic injury due to exercise and running, I'm a big favorite of orthopedics. And if you go to a typical ASC or a ward with all the navigation and robotics, you're still seeing orthopedics as a pretty rudimentary domain, unfortunately, right? Things have still been run the same way they have 20 to 30 years ago, other than planning probably in custom-made implants. So 2 companies that are, I don't want to call them, again, favorite child, but good stories and very elegant from an engineering perspective. One was Orthospin, which was an investment we did in Israel. It was an incubator company that came out of Trendlines, which we acquired in 21, which basically challenged the whole way of external fixation that's being done today for long bones, where it's a very cumbersome, low adherence, low compliance to treatment, mainly congenital defects, but a lot of teenagers are usually the people who suffer from needing to go through external fixation. And the basic procedure today is the same one that's being used in the 1940s in Soviet Russia. right? It's been finessed over time, but it's still the same idea of having 6 bony implants and rings, and you have to twist and turn screws, which is very painful and tearing open the skin and potential damage to tissue and infection and whatnot. And these guys basically took a few struts and connected them to a robotic controller, and now everything's automated and done remotely, wirelessly, and reports back to the doctor who just downloads a program. So again, this is not something that is by any means changing the paradigm or shifting the table over on its head. It's using existing tools and saying, hey, let's automate the entire process and make it easy. And that was a beautiful product. Great amount of people we brought into J&J, who are now all J&J employees and working on next gen and other interesting innovations in orthopedics. The other one was a more recent investment we did was a company out of Texas called Selenic, which leverages alternating magnetic fields to treat infections in orthopedic implants. So basically non-invasively hitting the implant from the outside and essentially killing the biofilm, which is the root cause of the infection, right? And again, this is physics 101, stuff you learned in college or university, right? Using magnetics to create current and then heat. But it's a out-of-the-box way to think about it, and hopefully will save a lot of limbs and a lot of patients eventually. So again, is cardio cool? Yes. Is robotics cool? Very much so. But if you're asking me personally, these are the really elegant solutions, which I always love to highlight.
No, I love that. There's another one I do wanted to bring up and get your thoughts on if maybe this is an edge case or maybe there's a trend here. But for those who are not familiar, there's a company called Laminar, privately held medical device company, which was focused on eliminating left atrial appendage in patients with non-vascular atrial fibrillation. What essentially happened was that they demonstrated that pre-market approval pathway companies can quickly reach an exit and essentially get an M&A prior to pivotal trial enrollment. So they did this within 4 years and with under $25 million invested, which is really, you don't usually hear that in medtech because it costs so much money to take these companies to market. But something like that is really encouraging. In your personal opinion, edge case, do you think there's a pathway to see more of those with the strategics?
Yeah, I can only speak for J&J, but we are starting to see companies, big or small, whether it's cardio, which is also very competitive as well, and I think that's part of why Laminar got acquired at that stage. Also, the fact that the technology was good and the team was an experienced team who has done this before and were very, very capable people. But we are seeing this, right? And there were a few conversations of companies that we had considered investing in that were, let's call them Series A, Series B. Some were potential PMAs or 510K de novos, but a long journey into the market where we had considered investing, and we had learned that one other competitor, not to name names, has said we want to consider an M&A, right? And this could be anywhere from cardiac, again, which is very competitive, but it could be also orthopedics. It could be robotics as well, which is becoming more and more competitive today. It could be ophthalmology. So again, I don't think it's becoming the norm per se. It's usually going to happen with groups of entrepreneurs and CEOs who usually have done this before, so it's not their first rodeo. They have a lot of kind of gravitas and experience, and the people who end up buying the company always end up buying the people, right? That's part of why you're buying the company. And I think we are going to see that. Is it going to be more and more? I don't know. I don't think so. I guess it's still going to be like the one-offs rather than the norm. We've experienced this before on the investment side. We've experienced this before on the M&A side. I guess it's just the nature of the business at the end of the day.
No, I totally hear you. I'm wondering also, you sit on a variety of boards. One of the more common ones is like Moon Surgical, which is a robotics company out of France. How do you look at the robotics landscape? Because I feel like maybe in the last couple of years, it's gotten new life. I think it was a little stagnant for a while, and now not necessarily just GeneSurge and soft tissue, but surgical robotics across the board seems to be getting a lot of investments in. Last year, not counting Neuralink, the number 2 and number 3 largest deals were all in the surgical robotics space. How are you looking at the surgical robotics market, and how do you evaluate these different companies?
Yeah. So first of all, I think what we're seeing a lot is most of the robotics companies are not taking a typical PMA route. It's mostly like a de novo or a 510K, and that's why I think we're seeing a resurgence of robotics companies, because they're are a lot of predicates, and most of them tend to be not these big systems like Da Vinci, like Ottava, like Hugo, which will be indicated to a multitude of surgeries, but are trying to be very focused on one indication or one domain. So like spine surgery or knee surgery or cataract surgery, etc. So I think that's, first of all, the sign of the times, right? They're trying to get in one way and then ideally expand if they can. I think the other reason is we're seeing this happening more and more is more engineers going to the market from the various big multinational players, from the Googles, the Amazons, people who have brought automation and robotics from other domains into healthcare and are trying to do something with more impact on people's lives. What I think we're seeing is we're seeing a lot, first of all, we're seeing a lot of Me Too's, right? We're seeing a lot of companies trying to do the exact same as a competitor, trying to do one thing better that one big company is doing, or be cheaper or be faster, et cetera, et cetera. And the fact that manufacturing for a lot of these components has obviously gone much cheaper over the last 5 to 10 years, whether it's the chip manufacturing, the molding, the plastics, the tools, is also making these things more, I don't want to call it readily available, but more easy to produce, right? Where I think we're starting to see a bit of a challenge is, as you rightfully said, we're seeing a lot of companies. So there's now going to be robotics in general surgery, which was the norm, and maybe spine and knee surgery, which were the more successful areas of robotics healthcare. Now we're starting to see robotics come into retinal surgery and cataract surgery and catheterization and valve replacements and brain surgery and other areas. I think where me as an investor, I'm challenging this is on two fronts. One, is there a product market fit, right? Because a robot obviously can't solve everything, right? You're not going to put a robot if the margins and the reimbursement you're getting in the procedure is low to begin with. That being said, though, if that robot enables to do 2 procedures in the time it would take 1 procedure to be done, then there's an economic argument, or even more than that, right? And then you're always going to go into the trade-off of, okay, it may save me some time or I can do more volumes of procedure, but if the robot costs a lot more money, then is the bang for buck discussion really worthwhile? So what we're seeing, and we saw this over the last 2 years with some robotics companies not succeeding to fundraise or doing flat rounds or down rounds or doing a complete pivot, is when the market started to subside and the money wasn't as available, those companies had to start rethinking their roadmap. And because most of these companies tend to be very capital heavy, both in terms of running the show and the operation, but also starting to sell, a lot of them ended up shutting down or trying to pivot to a completely new place, because you can't sustain a business with a very expensive product and potentially a business model that doesn't work, or an unmet need that isn't really as big of an unmet need as you had thought and presented to the investors. So I think when you look at robotics today, I think the technical, not to discount the technical challenge, I can never assemble a robot, but I think the technical challenge in general is mostly overcome at this point. It's just going to require more time and money, but it's really not the technical challenge that investors fear. It's more around the product market fit and the business model. Whereas, are you going to go CapEx? Are you going to go OpEx? Are you going to do pay-per-click? Is there a disposable aspect of things? Are you going to do imaging on your own? Trying to look at the various complexities of it, because it's such a multifaceted question. And if you look at the broader medtech world, robotics and robots in general, probably the more, if not the most complex medtech product you're going to get into the market. There's so many questions that need to be answered before you actually kind of bring a robot to market, that I think is the challenge most investors face today.
Yeah, I very well said. I completely agree. I think because I have a bias, because I started my career in robotics, so I can't help but love that space. The problem is that you're absolutely right. It is very capital intensive. And I think manufacturing has definitely improved over the years. But the problem is that the business model is really expensive, and the commercialization of these companies is extremely expensive. I think finding innovative ways to drive adoption and commercialization is going to be really big there. The part that I wonder is that's exciting, and I think we're seeing different versions of it, is that while Intuitive is the main player in that space, and what's interesting is that Intuitive now, with its technically 2 products, Ion and Da Vinci, has a larger market cap than Medtronic and Stryker, which I would have never thought the day would ever come. but they still haven't broken, I think, more than 5% of market share. And so there's a lot of opportunity there for maybe not just technological innovation, but I think business model innovation in terms of how you get a hospital to purchase and use these things. Because these hospitals are run by large corporations now. They're not standalone. And so they're really strict about how they spend their money.
Yeah, and I think the other part of it is not just the robot itself and what it enables, right? So there's obviously the better articulation and precision of your movements, and the smaller you go, the robot is going to be more profound in terms of its impact on the surgery, but it's also what you build around it, which I think Intuitive realized fairly quickly, and others are obviously following suit, including ourselves, as the software and the professional education and the insights and the analytics that you're going to gather from doing a robotic procedure and how that enables better treatment and better procedures down the road, that I think Intuitive really worked out really well so far. But I think this is another part of the complexity of robotics, right? It's not just about the robot. It's also about what it enables, right? It's not just the procedure itself. Is it easy to use? Do you like using it? Are you suffering from using it or are you not, right? Does it cause you back strain? Are you going to talk about this to your other physicians, older or younger? Or is the new generation going to play with it? Is the older generation not going to play with it, right? So there's so many complexities to something that if you would just take up, again, not to oversimplify it, but a stapler, for example, it's a very simple GUI, right? Or like an interface in general. Whereas a robot has articulation, it has the joystick, it has the visualization, it has the sensitivity, it has to comply with existing tools or its own tools. How does it integrate navigation? How does it integrate imaging? Intra-op, pre-op. It's just the full package that is as important as each and every component in that package as well, which I think is very difficult to crack.
Yeah, no, I completely agree. I'm wondering for you as an investor in your due diligence process, I feel like every investor has a part of their due diligence where there's a area that you see more companies trip up on than others. Is there something that comes to mind? Is there a general theme? Because you look at so many different types of companies across the board. I'm wondering if there's something there.
I'll say there's the obvious ones like budgets and everything that people tend to be more optimistic than they are, but that's very CEO and CFO dependent. I think the key thing that I don't want to call it trip, but maybe is very naive on some of the entrepreneurs, especially the first time entrepreneurs or those that enter this sort of new domain with this company, right? So somebody who's been in orthopedics and now goes to cardio or vice versa, is really reimbursement pathways. And where does that fall, right? Because a lot of them, especially in like cardio and neuro and orthopedics, there's a lot of reimbursement codes, and you could probably make it work using one of the existing codes. But the question is, first of all, is it enough? Secondly, is the physician actually going to code for that? Because some of them are going to say, well, it fits perfectly because one physician told us that way. But that may not be the case, right? There's a broader conversation that needs to be had with the payers themselves, the various reimbursement experts, and maybe with CVS, Aetna, big player type of situation where it's not just, hey, we spoke to this one KOL and we said it should be straightforward. And again, you're seeing this mostly with these sort of Series A, Series B companies, certainly not those that have been selling for years at this point. And I think that the fact that there's new pathways to get reimbursed, like the NTAPs and others that are making it at least easier to start getting into the market and then figuring out your way as you go. But I think that's the key question I always have. And we as a big company are always going to look at what does reimbursement look like. And I think that is probably the key tripping point.
Yeah, no, I think you're absolutely right. Because I feel like too many times the business model that the company is usually selling to the hospital is something that they don't start thinking about until they're fully commercial. And usually by that time, you're really late. And now you're dealing with a lot of problems that you could have solved like earlier on. And it's almost as you're going through a regulatory and clinical pathway, you should be going, I don't know what you would call it, maybe like a commercial pathway as to how are we going to sell this and how is like the end user going to make money off of it.
Yeah. And why, by the way, why should they make money out of it, right? Why would they be incentivized to use this versus anything else? And the question would be, and the answer would be, if they could get money for that, then they would be incentivized, right? If they can use this to get more money, if they can leverage another reimbursement code, if they can get more out of this same reimbursement code, or if you could just get a new reimbursement code and get them more money, right? Eventually that's what the doctors want to do. They want to get more money.
Yeah, no, I completely agree. And Tamir, I really appreciate you spending some time with us. But as we round things out, I have a few like interesting questions that I always like to ask investors and stuff. VCs and investors are a very unique class of professionals, right? Very competitive. But I'm wondering for you, like in your career, are there any investors, whether individuals or strategics, et cetera, that you personally maybe not look up to, but you learn a lot from, you like to follow? And it doesn't have to be limited to medtech, but I'm wondering if anybody comes to mind.
Oh, again, I don't think there's a favorite child, right? So not even a favorite uncle in that matter. But I think in general, when you sit in boards, whether as an observer or a director, the dynamics are what's important between the various board members and the CEO and management as well. And I think I sit now on 9 boards, which is by no means sustainable, but there are kind of repeat, I don't want to call it defenders, but repeat board directors, which I'm on the same boards with. And we always vibe very well together. And we like to have those conversations, sometimes casually, sometimes professionally, and sometimes both. Again, not to name names, because when you're naming someone, you're not naming somebody else. But there are a lot of people I like working with. Again, there's always going to be an N of greater than one with one investor that I sit on a few boards together. Right? And it's folks from Shanghai, it's folks from Sonder, it's folks from Pier 70 that sits with us in 3 companies. It could be smaller VCs, it could be larger VCs. I think at the end of the day, it's more of a personal philosophy rather than a professional philosophy. And I'll give my parents a lot of credit doing that, saying even if people were, pardon the French, assholes to you, always be nice to them. Always, you never know when you're going to meet them, when you're going to need them. So always be nice, always be friendly. And even if they're not friendly with you, always be on your good side with them. So that's the philosophy I try to apply with my companies, with my board members. Yeah, just a rule of thumb.
No, I totally agree. As my first manager, Tom, once told me, you never know when you're going to be back in somebody's neighborhood.
Yep, exactly.
Last question for you as we round things out. And again, you may not have one. I'm sure you do. I'm positive you do. But if you think about the last 10 years of medtech, okay, could be one of yours, it could be not. What's a medtech deal that you like? It's like a textbook example of great corporate investments where, the science was right, the model was right. It's like a great example of like how to do things the right way. What comes to mind?
So we mentioned OrthoSpin earlier, and I think that's a great story because we had considered it as almost a built to buy, right? And built to buys are typical corporate venture deals, right? So this, funnily enough, it started as an incubator company in like 2015, I think. And when we saw this initially, we weren't really focused on like external fixation. We were building our internal program. It was going well. It was supposed to launch in market. And nobody really cared about anything external. But then a few years later, Dr. Deckel, who was the chairman of the company, and he was one of the founders of Ortho Space, which Stryker ended up buying in 2019, but we were investors in as well. And he became the chairman of the company. And he said, you know what, I became this chairman and maybe you should take a look at this company right now, maybe a good fit for you. And our team looked at it and said, you know what, this may be a great add to our existing product, which is not ramping up in terms of sales and market. And this being an add-on can really help. So we took the Series A entirely on our own, just the $3 million then, and took very soft strategic rights, but basically said, let's help build this to be fitting with our system, assuming everything goes well in the development. And they were lean and mean and did everything the right way. And a year and a half later, we said, in the midst of COVID, we took the full Series B with another 5 million, if I'm not mistaken, and kept on advising the company and giving them a lot of the J&J know-how and capabilities so they can build the product to fit perfectly with our product. And eventually, when the time was right, when we saw enough clinical cases and enough reason to believe that this works as intended, we basically told our business development colleagues, guys, now's the time to transact. It's obviously not our decision to make, but if we wait too long, they may go someplace else. Right. And then began a long negotiation, which we stepped back as a typical role for JJVC. But all throughout, we were involved and aware and kept in contact with both sides. And I think this was like a really good success story of corporate investing, identifying an opportunity early on. It may not have been relevant at the time, but over time, our strategy evolved, it pivoted, people moved, people came in. And I think the most exciting thing for me was a year after the acquisition. It was a bit bittersweet, but it is what it is. I attended AAOS in Las Vegas, which was premier orthopedics industry of the world. And lo and behold, the OrthoSpin AutoStretch system sits in the front of our booth in AOS, right? And you're like, hey, we made that happen. We brought this to market. And I think even the cherry on top of it was the fact that I taken a picture in LinkedIn and posted and tagged Dr. Deckel and Oren, the CEO, and said, kudos to you guys for bringing a good product to market. And a week later, we were celebrating our JJDC 50th anniversary with a nice party in New Brunswick. And I get a call from the J&J CEO admin from like a blocked number. And she is asking me if it's okay for the CEO to comment on my LinkedIn post. I'm like, of course, I'm flattered. And lo and behold, a day later, Joaquin Duato comments saying, this is a testament to how we do innovation, how things really work, and brought it full circle to a beautiful kind of end shot of this journey. So again, nobody has a favorite child, but this is like the best kind of full circle story.
That's fantastic, and can't think of a better way to end. And Tamir and I really appreciate you coming on the show, but more importantly, what you and Jay do in the medtech ecosystem. I'm really proud of the space that we're in because what we do actually saves lives. And I'm excited to see what J&J has in store for this year, along with yourself, and definitely want to have you back on the show as a guest and a friend. So really appreciate it. But in the meantime, where can people find you online?
So I'm very active on LinkedIn. My Twitter is more personal, but I mean, you're more than welcome to follow it. Nothing professional goes there. I'd say mainly LinkedIn, trying to be very active. My contact details are very much public, both on our website and on LinkedIn. So if you need to catch up or do a sanity check on an idea, I'm more than here to help.
Fantastic. Tamir, thank you so much for joining the show. For our listeners that are listening, be sure to give Tamir a follow on LinkedIn. If you haven't already, subscribe to the show, give us 5 stars. And with that being said, I'm Omar Khatib, your host for the State of MedTech, and we'll see you all next time. Thanks for checking out this episode. If you want to do me a big favor and join so many other people who have helped grow this podcast, take a second and look below. If you're on Apple, give us 5 stars and write a short review. If you're on Spotify, just give us 5 stars. And if you're on YouTube, hit the like button. And most importantly, if you can, subscribe. We release so many different episodes that you may miss. Be sure to subscribe and turn your notifications on. You get extra points with me if you subscribe across all 3 channels. Thank you so much. And if you felt like this episode helped you, send this to somebody who'd really enjoy and appreciate it. Share and spread the love. We'll see you all next time.